So I'm here today with Dr. Kenneth Peters, who has been gracious enough to set up the first ever PFS, PAS, PSSD summit here in Detroit. Just wanted to introduce him to you guys and ask him a few questions. So it's great to meet you. Thank you.
Great meeting you too. I'm glad you could join us in the meeting.
Thank you so much. So just to start, it would be great to get a bit about your background, your specialties, what you do in the day-to-day, but then also how that might relate to these post-drug syndromes that you've come across.
Sure. So I'm the chair of urology here at the Carle Health William Beaumont University Hospital. And my practice really has morphed into taking care of complex patients. I take care of things that nobody else wants to take care of. And a lot of my practice has been around like chronic pelvic pain, voiding dysfunction, and interstitial cystitis. And, you know, we have a big research infrastructure here. We've been very active in research around a lot of these kind of more unique disorders. And, you know, being that patients come to see me, you know, who have seen, 5 or 6 other clinicians before coming here, it's really kind of brought patients in from all these different backgrounds, including, these post-drug syndromes. And I learned a long time ago, because of the type of patient population I took care of, is that if we live in our silos, we never find an answer. And, for years, like, interstitial cystitis has been thought to be a bladder disease, and it really isn't. The bladder for most people is an innocent bystander in a bigger process that goes on. So, I've been very much, supportive of bringing in experts in all the different disciplines and looking at the whole person, the mind, body, spirit. And that's how I approach my clinical practice. And, with PFS and these other post-drug disorders, over the years as a urologist, I certainly have seen young men and women come in with, complaints of sexual dysfunction or anhedonia and the like, with exposure to these drugs. And I probably, as I recall back, I'd say probably at least maybe 10 years ago, I think I saw my first young man who had been exposed to finasteride and was just devastated by it. And honestly, at the time, I didn't know much about it or even heard much about it. I'm somebody who always likes to look up things afterwards if I'm not sure, so I could educate myself. But what it did, because it was so profound in him, is it made me, from that day on, I never prescribed finasteride again, not even to my BPH patients, because I was just like, if this could happen to him, what could it do to other people? But honestly, I've been so busy with everything else, hadn't put much thought into this, but I felt like a moment happened in this past, couple years where, in a very short time period, literally within less than 2 weeks, I had 4 patients come in, and they were all young people, men and women, and they all came in with almost the identical complaints. They've been exposed to one of these drugs and then had an acute event that led to genital numbness, anhedonia, brain fog, all of these different things that we see with the syndrome. And, what I thought was like almost beating me on the head is that, one of them was after finasteride, and that was a physician. Another one was PSSD, who was a local young kid in the area who had been exposed by it and just devastated. And then, interestingly to me, I had 2 post-Accutane patients. One was a woman and one was a man. The man was a pre-med student and had completely normal life before this. He was an athlete, all A student, as happy as it could be. And the day, within a day or 2 of stopping his Accutane, he developed genital numbness, the anhedonia, the brain fog. Very hard to be that way when you're trying to be a pre-medical student. And it was shocking to me to hear that. And then my other one was a woman who was in her early 30s, been in the same relationship for years, have always been sexually active and very happy with her life, who was given Accutane. And again, when she stopped it, developed rapid genital numbness, and that had a significant impact in her life. And she, still is in that relationship. And thankfully, they've been able to stay together, but, lost the ability to orgasm, vaginal dryness, these other symptoms associated with it. And this all happened so kind of close together. I was just like, felt like it was like somebody telling me I needed to do something. And I think that kind of led to my initial investigation into these conditions. So
that makes sense. And so fast forward from there to now, what was the moment where you were like, I'm going to get all these people together that are kind of siloed across the world doing their various research projects? I believe you were familiar with Dr. David Healy for quite some time before today. Just talk me through that process where it's like, I'm going to do something now.
So because those patients came in this very short time period, suddenly I had like an N of 4 who were just motivated to learn things. And so I started basically doing more deeper investigation into them, both with like sensory testing. I'm a neuromodulation geek, so I was doing neuromodulation to the genitalia to see if we could improve sensitivity. We were doing like soft wave or shock wave therapy to try to improve tissue function, blood flow, nerve function, and basically seeing what I could do that was non-pharmacologic that maybe could help. And had them filling out questionnaires throughout this time as part of their clinical follow-up. And, we wrote up just a little case series we published on like 3 patients. I also did conformal, microscopy of the cornea, showed, nerve damage in that area, suggesting like this small fiber neuropathy. So that, just once we looked at those patients and said, there really is this need, really, I spoke to Bernadette Swans, who's my director of research, and I was to say, we need to understand this more. And so our next kind of thing we did is we chose to do a kind of online survey of these 3 different conditions. So we wrote a protocol, we went to the IRB, created an anonymous Qualtrics survey, and, basically posted it on social media, on Reddit, reached out to a lot of the advocacy groups out there. And it was shocking to me. I mean, within weeks, we got over 1,100 responses in all 3 categories. PSSD was the most, but PFS was right next to it. A little less, but we still had several hundred PAS patients. So, I mean, we heard from so many patients. And as we were getting this survey out there, my email was attached to it. And I kept getting emails from like family or parents asking if they could fill it out on behalf of their child who killed themselves. And it was just like devastating to me. I was like, how can that be? And, unfortunately, I'd have to say no and give my condolences. But it was that, just going through that process. And, right now, actually, we just submitted a paper this week for publication. We got 2 more almost ready to go out, presented some of it at our female urology meeting in February. But it was at that time where we got such a robust response. And when you look at the outcomes of these patients and what they're dealing with, looking not only at sexual dysfunction, but the impact of, their mood and their memory, and, the suicidal ideation was ridiculously high. And knowing that, I'm having, I see it online, I've had these parents reach out wanting to fill it out, I was just like we have to do better. Like somebody needs to stand up and try to sort this out. And so that was kind of the motivator to try to get a meeting together. But honestly, I really don't know the players in this field. I haven't been a researcher in it. I'm a clinician, but I have known Dr. Healy, and because I've reached out to him over time about some patient issues, and started talking to him, told him I wanted to do this, and then I essentially started scouring the literature of anyone who's published anything on these topics, and just to see maybe who would be or should be invited to a meeting like this. And then reached out to a number of again, the advocacy groups, because they all know the different people involved, and set out about, I think 21 invitations for not only PhD scientists, but clinicians, and then several advocacy groups, because I felt like they all had to be there, for this meeting to really encompass the entire, condition that we want to talk about. And what was, I mean, nobody knows me in this field, and certainly I did not know 90% of the people who were there.
Right.
But everyone I reached out to said yes, which shocked me, because here I am kind of cold calling, reaching out, saying I want to put on a meeting that's multidisciplinary. And then we've had people from, throughout Europe, Australia, I mean, coming, United States, coming from all these different regions. I'm fortunate. I've had some philanthropy for research and education. So I offered up, at least the ability to help with some of the housing and food, but they all had to pay their way and get here. And the fact that all of them said yes just said to me, like, what need there was out there to have a meeting like this.
Yeah, absolutely. And so I guess my last question would just be, the conference is completed. Would love to just get your general thoughts on, some of the takeaways, or, what happens now. I'd love to know into the future from this. This surely must be the impetus for some things. I'd love to know your thoughts on that.
Yeah, absolutely. So I got to say, I had some anxiety going into this conference right up until the day before, because I didn't know what was going to happen. Everyone has their things they study, their interests, they have their opinions of, is it peripheral, is it central? And I'm like, this is either going to be a disaster or an amazing experience. And thankfully, it ended up becoming an amazing experience. It took literally minutes of everybody getting in the room together to just really connect with each other, and having a group of just, brilliant people in a room who all have a common desire to understand this condition and figure out solutions. It really, I think it connected everybody very quickly. And it led to incredible conversations. And, if nothing else, just the conversations between talks and stuff that we're giving were probably the most helpful things that could happen. And, the clinicians often gave talks on the clinical side and the presentation, how they manage it. But then we had a lot of the scientists come with all the basic science and things that they're doing. And honestly, I didn't know a lot of it. So, I learned more than I was definitely a learner in this. And a lot of times when word got out a little bit that we were doing this, I had a lot of people wanting to join, but they wanted to join to learn. And most conferences I put on are to educate others. We have an audience that we're teaching them. And I wanted to keep it very small and very intimate, because what I knew had to happen before anything else is we had to learn from each other. And I feel like that we were so successful in doing that during this conference. And as I kind of reflect on it, it just ended, you were just there. And, today was all about next steps, right? And one of the things that we intend to do is we tend to publish the outcomes of this Congress. And basically today we spent the day outlining what should an extended manuscript look like for that. And, I feel like we have a great outline for that. We have, writing assignments and all this to move forward. But a lot of it, we don't have the answers. We have a lot of questions, but I think we're going down a path that we're going to learn a lot more. And the end game is to improve patient advocacy, patient outcomes, discover underlying causes and how we can prevent or treat these conditions. So this, to me, this is just like step one. And, we're going to set up a Teams meeting in June to kind of move forward the manuscript. We just actually, as you were just setting up your cameras, I just saw this WhatsApp link come across inviting everybody who was at this meeting on a WhatsApp page so we could continue to communicate with each other. And, part of this end today was talking about like research questions that we should really focus on. The limitations, funding, right? It's like, how do you get funding for this? But in the end, as I sat there objectively, because like I said, there's way smarter people in that room than I am. You can't sit in this meeting for the last 2.5 days and deny the post-drug syndromes. There is such clear evidence that there is a physiologic thing going on, and it infuriates me when I hear the patient blame side of this. So, at the end of this, I just hope that this provides hope for patients suffering from this, that they understand that there is a consortium of brilliant people who are trying to find answers, and this to me is just step one. It's kind of now become my passion, so we're going to do what we can to continue to move forward on this whole understanding PFS, PAS, and PSSD.
Well, that's fantastic. Thank you again so much, Dr. Peters. I really appreciate it.
All right, thank you very much. Appreciate it.